He's from. Because you know, for school events, for class night, because she has her images and the drama on there, you know, like a book sale's coming up, and she's like, don't, a flyer will come out with 4 words in it, don't sell out the books yet. And then there'll be a line at the top, wait until the sale, whatever, you know what I mean? And it's just, I mean, sure, I think it's how nice it's working. I could use her talents for something.
Yeah.
She writes the text for the posters.
Yeah. It's good that you did that out of the house.
It doesn't have all the somebody else who knows about that. Somebody, you know,
my son having been a one of my son's doesn't. So he's trying to all the kids schooling. That's their choice. Don't get in there.
my mother never went to school.
Yeah.
There was PTA that was
And my mother never went to school.
PTA and cupcakes and that to get teachers. It was the same sort of thing.
Yeah.
We're the teachers and we know how to teach. They'll come in and start teaching.
What I find remarkable, I'm a librarian, and what I find remarkable is that it not only doesn't bother them,
Yeah.
I never see that. Because I would definitely, teach your signals. I should have been
It's an interesting process.
Yeah. They came in with an oceanographer for like that, and a small Butz
He started there with Lenin and kind of worked his way out. One man had one they all play on that was first grade.
I don't mind doing it. It doesn't matter of style. Otherwise, what about the
But it was tough. It was tough to just go one really cool for that. Lots of people. I remember when I did it at social media. I actually sat down with my son and even know that that's good. You got to do this. I got to do this. Define the number of things in the presentation. He wanted to do it with me. And what he did was much more positive than what I did.
Because he knew what to do.
Yes.
Well, it's interesting to him.
And as soon as he did this stuff,
Sheets that compare countries and states.
Yeah, I think
We don't teacher that divides an exercise.
That's great.
It was fifth graders and sixth and seventh graders.
Yep.
I guess
It's easy because we wrote them all. They're all open. They're just down.
oh, are they? Great. So you
Connected that the thing that guides the remote. Do they put it back in? Yeah, it's there.
Oh, why?
We had to take it out to use the memory stick.
I know that. I just wanted to. I shouldn't encourage it.
So does he come up?
Yeah, fine.
And I never have had that work. For some reason, today I did. And it wasn't. And does the door say which one? No, I haven't done
It's just easier because if you come to Metro, go straight to instead of walking across the lines.
you don't realize where you
You
are.
have to do is come out, go up the street, it goes up the stairs.
They're doing a lot of memory
Yeah.
Well, good morning, ladies and gentlemen. I want to welcome you to the Woodrow Wilson Center. My name's Jeff DeBelko, direct the Environmental Change and Security Project, and we are thrilled to be taking advantage of or honoring or drawing attention to the 75th anniversary of Population Reference Bureau. One of, I think it's fair to say, one of the very best friends of the Wilson Center and the Environmental Change and Security Project. We've had a long time collaboration, and so we're very pleased that really such a distinguished panel from PRB is here to talk about population health and environment. For those of you who might be new to the center, we address these kinds of issues in well, in a consistent way through meetings, but really trying in some ways to find linkages among these topics and then even furthermore take them out into the realms of foreign policy, development policy, even security policy, and understand how these issues relate. We do that through meetings like this one. We do it through publications like the ones that you'll find out front, and we're pleased, as in a number of cases in the past, this issue has a contribution from Roger Mark D'Souza on POP environment and health. And so as well as hearing it from him today, you can read about it in our publications. The Wilson Center itself was founded in '68 and is a nonpartisan, non-advocacy institute that's actually the official memorial to Woodrow Wilson that brings the worlds of scholarship and policy together. Wilson was our only president who had a PhD, and there are all sorts of wonderful quotes about how these two worlds politicians and scholars need to learn from one another. So that is, in fact, what we're engaged in today. I'm going to, in fact, turn the floor over to Bill Butz, the president of PRB, to introduce his colleagues and say a few words himself. But we're very pleased that we're going to hear about family planning in Cairo and where we are and where we aren't from Cairo, from POP environment, and also gender approaches to family planning and reproductive health from this distinguished panel. So Bill, I'll turn the floor over to you, and I'm going to sit down so I can see the slides.
Thank you, Jeff. It really is a pleasure for us from PRB to be here. There are four of us up here, but what we'll be saying really reflects the research, the knowledge, the expertise, and the experience of many people at PRB. And when you say, Jeff, that we're institutional friends, we certainly are, and personal ones too, and we appreciate the invitation to appear here today. Well, Frederick Mosteller, who was one of the great, if not the greatest, academic statistician of the middle of the 20th century, said, "It is easy to lie with statistics, but it's easier to lie without them." Well, today we're going to be talking about statistics and about evidence and about data and how they relate to policy and programs. And in that context, you may have read that Mark Twain said something a little bit more incendiary, speaking about the world's greatest deliberative body, located here in Washington. He said, "On Capitol Hill, the truth is just another lobby." But the thing to keep in mind is that it is a lobby. It belongs there. It can have an effect along with the other lobbies. Now, some of you here today, I know, are here, you're experts. You've spent your lives working on one or more or even all of the topics that we're going to be talking about. We're delighted that you're here. Some of you are here, I know also personally, not because you're experts, you're not experts, but you have a passion and a curiosity for the subjects that we'll be dealing with. And our intention today, the four of us, is to send you back to work and to home, and to send us back to work and to home with new knowledge and new understandings, whether you're here because you're an expert or you're here also because you have a passion and curiosity. In discussing evidence-based approaches to policy and programs in population health, gender, and the environment, we're going to take an integrated view here this morning that ties together phenomena that are in fact tied together in the real world out there, in the way people live their lives, in the way we people interact with our environment, and in the way policy and programs are conducted. But even though the real world integrates these things, too frequently they are not integrated in the data, in the research, and in the policy and in the programs that seek to improve people's lives and improve our interactions with the environment. And we're going to try to make some of those connections here today as we talk about fertility, family planning, reproductive health, gender, and the environment. We'll be reaching back half a century because even half a century old programs and policies still rely on current evidence, on current data, on current statistics. And we're going to be looking a half a century into the future as well. The hallmark of each of our presentations, as I said, is going to be these linkages. And we're going to be trying to make the point, to convince you, if you need convincing, that intelligent approaches and intelligent understandings of gender, of the environment, of health, depend upon understanding the linkages of those things with population and with demographic study of population. And it's those linkages that we'll be attacking here. The Population Reference Bureau has for 75 years been positioned at the intersection of these things, of topics such as fertility and reproductive health, population and the environment, children and families, aging, migration and urbanization, inequality and poverty, gender and development. That's what we've been doing. And we do it by conducting workshops, by printing and distributing publications, by maintaining an excellent website and set of website materials, by training, by working with media, opinion leaders, and policymakers in this country and around the world. And it's some of that work that we'll be reflecting this morning. And in so doing, we attempt to build individual and institutional capacity to communicate research findings when we're not there anymore, to train people to communicate, to find the data, and to communicate them effectively to policymakers and opinion leaders. And we build partnerships while we're doing this. Our speakers today are experts in their fields, and as I said, their presentations reflect not only their own expertise and experience, but that of many of our colleagues at the Population Reference Bureau and of some here in the audience who have produced the data that we'll be talking from, and some who are in charge of policy and programs around the world. After they speak for about 15 minutes each, there'll be 40 to 45 minutes and maybe a little more for open discussion. And that's the period, I don't know what you're looking forward to, that's the period we're looking forward to, because that's the point at which we're going to learn and we're going to get new knowledge and understanding that we'll take home with us. Let me introduce the speakers briefly, and then they'll simply stand one after the other, speak for about 15 minutes each, Don't watch your watches. I said about 15 minutes each. And after that, we'll open it up and have either a genteel discussion or a free-for-all or something in between. Nancy Yinger, who will be our first speaker, is the director of PRB's international programs and of Measure Communication, our principal project. That is old. You're not anymore. Overall charge of Measure Communication.
Measure Communication is now in the hands of one of our colleagues there.
Let me call it Bridge. Thank you. She's a demographer with more than 20 years' experience in reproductive health, family planning, demography, gender, and policy communications. She's worked at PATH, at the International Center for Research on Women, and at USAID, and her graduate degrees are from Johns Hopkins. Second will be Lori Ashford. Technical, let's see if I can get this one right now. Third, no. Lori is technical director for policy information and international programs. She's written a great deal, authored and edited a wide variety of publications, our population bulletins, our briefs, materials for the web, and so on. She's worked in USAID's Office of Population, at the International Planned Parenthood Federation in London, at the U.S. Office of Management and Budget. And her graduate degree is from Georgetown School of Foreign Service. Roger Mark D'Souza directs the overall activities of PRB on population health and in the environment, and he designs, writes, studies, gathers data, and also trains in the U.S. and all over the world. Conducts policy analysis seminars on a wide range of development issues. His graduate degrees are from George Washington University and the University of the West Indies. So, without further ado, let me introduce our first speaker, Nancy Yinger.
Let's see if I can figure out how to get rid of this thing. Hit escape. Let's do that. That didn't help. That's okay, I got it now.
Okay.
We're getting there, everybody. Whoops, and I went one too far. All right, I still haven't mastered all these technologies. I should have. And I need to be a little taller so I can see over the computer. Good morning. I'm really delighted to be the first speaker on this panel to celebrate PRB's first 75 years. Thank you all very much for coming out to hear us today. Throughout my education and career, I've been interested in and an advocate for gender issues. So I welcome this chance to share with you all PRB's commitment to gender. And I will define what I mean by gender in a couple of minutes. I also want to recognize my colleague, Charlotte Feldman-Jacobs, who helped me pull this presentation together. Now, this is a PRB, right? We're talking about PRB, so I have to start with some statistics. Here are some about PRB. If you go to PRB's website and you click on the word gender in the left navigation bar, you're going to find over 80 articles and reports that PRB staff have written about gender. Further, if you go a little farther down to the two websites for the Interagency Gender Working Group and also PH InfoShare, you'll be connected to more than 200 reports written by our partners around the world on gender. All these documents are frankly just the tip of the iceberg of our commitment. Gender goes to the heart of International Program's mission to contribute to an improved quality of life for children, women, and men around the world. In this talk today, I actually want to move beyond the kinds of gender issues illustrated by these two headlines, which are from the Sunday New York Times for May 8th, ironically Mother's Day. The first article discusses the all too frequent gender-based violence experienced by women who travel to Middle Eastern countries to earn money for their families. The second one addresses in detail the plight of young women caught up in Central Africa's ongoing violence. They compel us to think about the victimization of women isolated from their families by choice or by force. These women, trapped in unusual circumstances, certainly need help. What the articles don't force us to recognize are that women face challenges in improving their health because of standard, average, ordinary gender norms that encompass them every day. These norms are not the same in every country. In some countries, women are free to travel, but they face female genital cutting. In other countries, they are expected to work outside the home and still carry the full burden of childcare and household tasks. Men face everyday gender obstacles too. In some places, virility is assessed by how many children a man has, making it quite tough to keep up one's pride and control one's family size. To address everyday gender obstacles that keep women and men from achieving better health status, there is mounting evidence that we need to incorporate a gender perspective into health and development programs. The differential health challenges women and men face are rooted more in social norms than in biological differences. Barriers created by gender roles can, for example, make it difficult for women to obtain services if they lack freedom of movement, access to household resources, or access to the education that will help them make good health choices for themselves and their families. Men also may find it difficult to use reproductive health services that are set up for women and children. In addition, men need to be involved in efforts to redress gender inequities because to change gender norms, programs have to address both sides of the power imbalance.
Excuse me, would it be possible for the other speakers to perhaps watch the slides with us from the floor, and then we might all have a slightly easier view of these very interesting slides?
Good idea.
Has everybody started worrying about this list now? These data illustrate differentials in health. The table shows the top 8 health conditions that contribute to death and disability around the world, as assessed by the World Health Organization. WHO calculates this disease burden, technically known as DALYs, or disease-adjusted life years, as a way to help policymakers prioritize health spending. You can see that the list, while similar for men and women, is not identical. Some of the differences are biological. We have, for example, been hearing a lot in the news recently about how women experience heart attack symptoms differently than men, but some are not. Why is depression at the top of the list for women? And why are traffic accidents, alcohol disorders, and violence so prominent for men? PRB recently released a new data sheet, Women of Our World 2005. Lori Ashford, one of the co-speakers this morning, assessed the indicators that show progress for girls and women and those that don't. On the positive side, in most developing countries, girls' school enrollments have risen markedly, more couples are using modern contraception, and women are choosing to have fewer children. In addition, women's share of the non-farm workforce has edged up slightly. But women everywhere, particularly those in the poorest countries, still face social and economic disadvantages relative to men. For example, girls' literacy and schooling lag well behind boys in much of sub-Saharan Africa and South Asia, and childbearing begins early in these regions. Deaths related to pregnancy and childbirth, though tragic and preventable, show no signs of abating. Women and girls are half the world's population, but still hold less than 1/5 of the seats in national parliaments around the world. The data sheet provides important information to understand gender issues, but more needs to be done to give gender a more prominent place in policy dialogues around the world. One of the key determinants of issues that receive policy attention is the availability of indicators and good data to indicate the problems and progress towards addressing them. While social scientists have included gender in research for a long time, it is notoriously hard to measure, to disentangle the gender aspect of a problem from poverty, lack of services, poor logistics, etc. Demographers like me have, for example, conducted extensive research into determinants of fertility. When I was in graduate school, a long time ago, models included gender, then called status of women, indirectly, usually relying on education, which was assumed to encompass a range of issues, such as whether a woman came from a traditional household, whether parents allowed her freedom of movement, and whether she could understand and use new ideas and information. That is a lot to hang on one indirect variable. Luckily, social scientists have become more adept at understanding the gender dimensions of social and demographic issues, and we now have data to look at a range of variables to help understand how health decisions are made. The following list is from the gender team at the Demographic and Health Surveys. That team is headed by Sunita Kishore. In addition to more sophisticated modeling, thanks to demographic and health surveys and others, there is an increasing body of data from developing countries that increase our understanding of gender and health. However, these data are not available for all countries, and sometimes people still rely on proxy measures. For example, one of the Millennium Development Goals addresses gender inequities, but the only indicator currently being measured is education. To be fair, 5 years into the process, a task force is currently developing a broader set of indicators to measure this Millennium Development Goal. The USAID Interagency Gender Working Group, for which PRB is the dissemination wing, supported an extensive review of health projects that incorporated a gender perspective. In that report, called So What?, a look at whether integrating gender focus into programs makes a difference to outcomes, Carol Bender and several other colleagues reviewed more than 400 projects and chose 25 that have sufficiently well-evaluated efforts to draw conclusions. The authors of the paper provide the following broad summary of their work. Interventions to transform gender relations report positive reproductive health outcomes. There are more initiatives demonstrating results in STIs and HIV than in other health issues. And finally, there still is a great lack of project evaluation along gender dimensions. I'm going to present 3 examples from that review to illustrate the power of working to redress the ordinary, everyday gender obstacles that men and women face. The Population Council has done a large experiment in northern Ghana called the Navrongo experiment. It is an operations research project designed to address the challenges of improving reproductive health in a traditional patriarchal society. Researchers compared 3 delivery models with a control area. The population in the most intensive experimental area experienced a significant decline in fertility. After 4 years, its fertility was 16% below the level in the control area. Researchers attribute this to the impact of outreach services and to intensive male mobilization strategies to help men better understand their roles in supporting women's reproductive health. The experiment also highlights, however, that changes in gender dynamics do not come easily. Project evaluation also revealed an increase in domestic violence as women and men adopted new behaviors. International programs at PRB focuses mainly on developing countries, which tend to have higher fertility. However, there is currently a lot of interest around the world in the determinants and consequences of low fertility. I was alerted to a gender angle to explain very low fertility by a PRB policy fellow, one of a group of graduate students from USAID-funded countries that come to PRB every summer. Dr. Christina Bratatan was studying the very low fertility in her native country, Romania, drawing on the work of Peter MacDonald and others, which suggests that in Southern Europe, the combination of high levels of female labor force participation and traditional family patterns in which women are expected to provide childcare and maintain the household leads to very low fertility levels compared to the Nordic countries, which have more equitable gender relations in the family and more government support for maternity benefits and childcare. In 2003, John Caldwell and Thomas Schindelmeyer published a long review article on low fertility. The authors caution not to treat Europe's very low fertility countries as homogeneous, and provide evidence for a range of determinants of very low fertility, including economic crises in Eastern Europe. However, the literature also provides ample evidence that gender inequities within the family are also a determinant of very low fertility. Maternal mortality is, to me, the ultimate gender indicator. Each year, pregnancy and childbirth claims the lives of over 530,000 mothers. In many developing countries, women's status is socially defined by motherhood, yet societies have not made the necessary investments to keep women alive. As Fred Tsai, a renowned Ghanaian advocate for reproductive health, said, "No country sends its soldiers to protect their country without seeing to it that they return safely. And yet mankind for centuries has been sending women to battle to renew the human resource without protecting them." These data show women's lifetime risk of dying of maternal causes. This measure combines the maternal mortality ratio with the number of children women have, i.e., the number of times they are exposed to the risk of dying in childbirth. The numbers make it clear that this is a significant problem in developing countries, particularly in sub-Saharan Africa. In your handout, if you picked one up, there's a mistake. It says that this project took place in Peru, but it actually took place in Bolivia. That's the PRB obsessive-compulsive nature led me to notice that this morning. So I want to tell you about one project that was reported in the So What paper. They reviewed 3 maternal and neonatal health projects. And the one that I think tells an excellent story is Bolivia's WARMI project. Using a set of gender-sensitive interventions, including participatory problem solving and efforts to involve husbands, the project demonstrated improved maternal and neonatal health. Maternal mortality declined from 141 maternal deaths per 100,000 live births to 99, and neonatal mortality declined from 70 births to 1,000. From 70 deaths per 1,000 live births to 16. Women make up almost half of the HIV infections worldwide, and 58% of infections in sub-Saharan Africa, where the virus is spread predominantly through sex between men and women and is prevalent in the general population. Women's low status relative to men puts them at heightened risk of contracting the disease. Women are often unaware of their husband's or partner's HIV status, may be unable to refuse sex, or have difficulty negotiating condom use. The risk is particularly high for young women who are biologically more susceptible to the virus and often have relationships with older men who have previously been exposed to HIV. The So What paper provides examples of 10 HIV or STI projects that included a gender component. For example, the Sonagachi project in Calcutta. Commercial sex workers were provided with a range of services to help them better address both their health status and their other life circumstances. A project evaluation showed an increase in knowledge and improved reproductive health behaviors, for example, condom use, that led to a reduction in sexually transmitted infections. Thank you very much for coming to help PRB celebrate our 75th anniversary. I hope you will go away with the sense that there is an increasing body of evidence that there are effective ways to address and measure the ordinary, everyday gender barriers that women and men face. However, even with these tools, the job is far from done. We look forward to working with partners, including many of you in the room, I hope, to keep gender on the global policy agenda. Thank you.
Thank you, Nancy. Lori Ashford.
Let me just get set up here. Ay, ay, ay. Okay, good morning. Thank you, Bill, and thank you, Nancy. and thank you all for coming. For my presentation, I'm going to put a spotlight on family planning. Yes, remember family planning? It's a topic with a half-century of history in the population field. And the reason for the focus today is that family planning has been in the shadows internationally. In recent years, it's been pushed to the background because of many other pressing issues. And what I'd like to do is bring it out this morning, review with you the reasons for the loss of visibility of family planning, talk about why we should still be concerned, and talk about ways that people have been working recently to bring more attention to family planning. Now, for a half-century of history in 2 minutes or less, for those of you who haven't lived and breathed these issues for decades, I'll just quickly review. Family planning has long been linked to concerns about population growth. Making modern contraceptives available to couples everywhere in the developing world has been key to bringing down high fertility rates. And from the 1960s to the 1990s, those who advocated family planning programs worldwide had a fairly simple argument to make. They could say that helping women control their fertility, it was key to reducing runaway population growth, which posed a barrier to development. Now, these kinds of messages are very effective for garnering political support, particularly among donors. I should say that the health of mothers and children have always been an important goal of family planning, and the evidence is strong that family planning does improve women and children's health. But mothers and children perhaps don't galvanize politicians in the same way as a population explosion, hence the rhetoric. The 1994 population conference that was held in Cairo was a turning point for everyone working in family planning. The conference broadened the focus of population concerns to include women's reproductive health and rights, and women's rights to information and services beyond contraception alone. And this was a positive turning point because it's better to view family planning in the context of people's lives and health and in a human rights context. Now, to fast forward to the present, I'd like to talk about how people working in family planning and population view the field today. I'll share some quotes that were presented in a paper by Amy Choi and Anne Blank at the PAA annual meetings this spring. It's an interesting paper because they interviewed people working in family planning both in the U.S. and abroad and found that most respondents perceived that there was less visibility, less high-level support, leadership, and priority attention to family planning than they had enjoyed in earlier decades. And the first reason is, unfortunately, the broadening of the agenda to include reproductive health has had the unintended consequence of overwhelming weak health systems in some countries and diluting, to some extent, a clearer, focused message. So you see one respondent said here, since the Cairo conference, family planning is only a component of reproductive health and not necessarily the most important one. Another respondent said, when reproductive health becomes too big, family planning gets lost. The trouble is, it's no longer a focused program. The second reason for the loss of visibility is the rise of the AIDS epidemic. Funding for HIV/AIDS has increased dramatically, as it should, and many family planning professionals see the funding for their work being crowded out by HIV/AIDS. So, as one respondent said, as a funding priority, AIDS stands out in a class on its own. What's left for other programs? A third reason is in the U.S., conservative opposition to family planning and reproductive health has a dampening effect on programs overseas because the U.S. has such enormous financial and psychological influence. So you can see what a respondent overseas said, if America doesn't want it, why should you introduce it? Another person said, the problem in the U.S. is almost invariably in this. You can't be just for family planning, you must be for abortion, and so forth. Those were not the only reasons cited in the paper, but to turn to other messages you may have heard recently, both outsiders and insiders in the population field have argued that the problems of overpopulation have essentially been solved implying that family planning may be no longer needed. So here's a quote from Newsweek from last fall. Remember the population bomb? The new threat to the planet is not too many people, but too few. And these kinds of news reports have become very common because of low fertility in Europe and China and East Asia, where women have fewer than 2 children on average, and there are concerns about a population decline. But also, because fertility is falling throughout the developing world, demographers talk about the population problem as being solved. Here's a quote from demographer John Caldwell and colleagues. He wrote in 2002, family planning programs like the fertility transition they help to drive will be a transient phenomenon. And what he and his colleagues were saying was that the transition from high to low fertility in developing countries is well underway, and that by the year 2050, organized family planning programs will be no longer needed. Now, I find both of these comments here to be premature. To talk about family planning not being needed 50 years from now, when family planning has just been around for 50 years, is a bit like calling the game at halftime, to use a sports analogy, or after the 4th inning, because we're watching baseball now, right? What the evidence shows us is that there's a lot to do today, here and now, and this is where we should be focused. So why should we be concerned? I'll show some data for each of the points shown here. First, there's evidence that fertility decline doesn't necessarily proceed in a straight and orderly path. In some countries, there can be slowing and stalling along the way. We know that unmet need for family planning and unintended pregnancies are common throughout the developing world, and these have important health consequences for women. We also know that needs are highest in all societies among the poorest women. And finally, even in countries where fertility is low, women still have family planning needs. So to get to the data, because we are PRB, I'll begin with the demographic rationale for family planning. We'll look at fertility decline in developing countries. It's far more complex than news reports would have you believe. You can see 3 very different patterns on this graph. Uganda is the top line, Bangladesh is the middle, South Korea is the bottom line. In countries like Uganda, where women have 7 children on average, there's a small group of countries in Africa that have not had any fertility decline at all. And then South Korea, the other extreme, there are countries in East Asia and elsewhere where fertility rates have fairly dramatically plunged and are now below 2 children per woman. But most developing countries are somewhere between the top and bottom lines. And if you look at Bangladesh, they've had a fairly steady decline, but then it leveled out in the 1990s. And demographer John Bongartz at the Population Council has written about a phenomenon called stalling. There can be bumps and plateaus along the way on the path of fertility decline, and no one knows how long countries like Bangladesh, Kenya, and several others that have experienced this, no one knows how long that can last. All we can say is that there's no guarantee that fertility decline in all countries are going to follow a consistent path and they're all going to converge at 2 children. We just don't know that yet. And family planning, along with socioeconomic development, is part of the equation in moving countries along that path. So where are family planning needs the greatest? Demographers always talk about unmet need for family planning, so I'll show it to you here. The graph shows the potential need for family planning. The total bars are the percent of married women who say in surveys that they prefer to avoid a pregnancy. And the green portions of the bars are women who are using family planning. The blue portions are women who are not. And it's those women that are referred to as having an unmet need for family planning. You can see in Africa, the African countries here, in Haiti and Nepal, 1/4 or more of women fall into this category. It's as high as 40% in Haiti. Not only is unmet need highest in the poorest countries, it's highest among the poorest women in all countries. And demographic and health survey data also allow us to look at who uses family planning among the poorer and better off groups. These data, the green bars represent the poorest wealth quintile, the blue bars the richest wealth quintile, or 20%. The quintiles are developed by using a household assets measure. What you can see is that in countries across Asia, Africa, Latin America, contraceptive use is consistently lower among the poorest women. And in all the countries that have this kind of survey data, the gap from rich to poor is more than 4 times on average. And I think the data raise some interesting questions. Can family planning programs essentially run on autopilot from here on out? Is the demand for family planning, because fertility is declining, is the demand for family planning so well established that couples everywhere will find a way to use modern contraception? And if we know that the poorest women and couples are the least likely to be using, can the market take care of it without strong political leadership and funding and priority attention in national programs? Can it happen? I think these are serious questions. And we don't want to forget, while we're on the subject of market failure, that women have needs in countries where fertility is low. Here's an example from Romania. We're back to Romania, as Nancy mentioned earlier. Women have only 1.2 children on average. In Romania, only 30% of women use a modern method of family planning, while the other 2/3 are either not using a method or are using a traditional method of family planning. These methods are less effective. The consequence of that is that more pregnancies are unintended than intended, 60% compared to 40%. And in Romania, women have, on average, almost twice as many abortions as births. This is a pretty extreme example, but one we need to be concerned about. The World Health Organization estimates that 20% of pregnancies in the developing world as a whole end in abortion. So to remind ourselves why we should still be concerned about family planning, as a preventive program, family planning is a first line of defense against many health concerns that we all share. We have strong evidence that family planning use reduces abortions, and this relationship may not have been emphasized enough. Family planning helps prevent maternal deaths, improves child health, and it's also linked to efforts to empower women and raise their status, as Nancy talked about earlier. And for those concerned about HIV/AIDS, family planning helps prevent mother-to-child transmission of HIV by helping HIV-positive women avoid unintended pregnancies. For all these benefits, family planning is relatively cheap. The methods are low cost. Many can be delivered in non-clinical settings. It remains one of the most cost-effective investments that governments can make, so much so that if it weren't politically sensitive, we would almost say it's a no-brainer for donors and governments to invest in. So at the current crossroads where we find ourselves, what are the options for revitalizing interest in family planning? It seems unlikely that old thinking and old rationale will help in regaining interest. It's more likely that family planning can be revived if it's linked with other issues that policymakers do care about. And I'll describe 2 efforts that are underway now. The first, USAID has an initiative underway called Repositioning Family Planning in an Era of HIV/AIDS, in which a task force of USAID staff and cooperating agencies are developing strategies and messages for reaching high-level policy audiences in sub-Saharan Africa, where needs are so great, and building coalitions to get family planning back on the agenda. PRB is also assisting in this effort. What the task forces are doing is developing evidence and presenting evidence on how family planning can reduce maternal deaths, AIDS infections, and so forth. And if anyone here is working on in areas related to that initiative, feel free to talk about it afterwards. Another critical opportunity to increase visibility for family planning is the upcoming Millennium Summit this September. For those of you who aren't familiar with the Millennium Development Goals, in 2000, world leaders agreed to a set of goals and targets for reducing poverty and improving health called the Millennium Development Goals. And these have become a major focus of development work because there are time-bound and measurable goals that governments are held accountable for. They have to report on them. Unfortunately, family planning is not mentioned anywhere in the goals, targets, or indicators that governments are reporting on, nor is reproductive health, broadly speaking. The Millennium Project task forces that are working under Jeffrey Sachs have recommended that in the resolution to be adopted in September, some indicators related to access to reproductive health and family planning be included in the resolution. If anyone here has contacts with high-level delegations or officials that are going to the meetings, let's talk afterwards, because it's a very important issue, a very important opportunity for getting family planning back on the international agenda. Talking about the Millennium Development Goals leads me to a concluding point. Policymakers are often swamped as many issues compete for their attention, and particularly in developing countries, many issues are competing for scarce resources. We have a difficult job to do at PRB and in other population organizations because the data that we have to present are complex and nuanced, not an easy sell. We have a lot of evidence. It can't all be reduced to sound bites. We can't present family planning as a standalone issue, but we need to present it as linked to many other concerns, poverty, gender equality, and a range of health concerns. The story that we have to tell is complex, and quite frankly, it's difficult because it's politically sensitive as well. But notwithstanding the complexity and the politically sensitive nature of the issues, the story that we have to tell is still as necessary as ever. So I'll wrap up there, and I'll appreciate your comments on this afterwards. Thank you.
Thank you, Lori. Roger Mark D'Souza.
Thank you very much, Bill and Lori. So we move from family planning and gender to talk about the environment and thinking about ways that we can connect the dots. How can we bring all of these together when we talk about population health and environment? I'll invite you to have a look at the screen and look at these images. And as you look at these images, you see people interacting with the natural environment in a variety of ways. In ways that may have an impact on their well-being and health. You see young people, older people interacting, and what I'd like to focus on in this presentation is ways that we can bring those dots together, bring these aspects together. And I was reminded of the importance of looking at population health and environment interactions last week. I was in Thailand working on a project that looked at the population health and environment dimensions of the tsunami disaster. And it was quite interesting as we met with local representatives working on rehabilitation after the tsunami. We saw some of the effect of the tsunami in these coastal areas. Here you have the impact on a coastal area in Thailand when the second wave hit. And quite dramatically, you can imagine the populations living in this coastal zone being suddenly affected by this disaster, which of course was quite devastating and quite dramatic to see on the ground being there. As we sat back and met with local communities and officials looking at what had happened, it was quite interesting to have a perspective on where things stood before the tsunami hit and afterwards. And as we looked at the area before, and in this particular area, we got a sense that the resources in this area were overexploited, that the area, this coastal zone, was fairly overcrowded, and as a result, a number of the resources were fairly deteriorated. As we looked at the effect of the tsunami in this area, we were reminded of how these questions of population, health, and environment can affect our well-being when events like this happen. Had mangroves and the mangrove ecosystems, the coastal ecosystems in this area remained intact, had the coral reefs been preserved, might they have presented a sort of buffer against the devastating impacts of the tsunami? It may not have avoided it, but may have mitigated the impacts that we saw. Had there not been such a concentration of people in these coastal areas, both tourism and people moving in to work in the tourist sector, might less people have been affected? Had there been a greater recording of land use patterns, settlement patterns, would have disaster relief and rehabilitation efforts been better, and might have donor funds been better used in that effort? By bringing together these questions, looking at population composition, the gender and age structure in these areas, might we have gotten a better sense of how different people were affected by what happened? So when we think about ways that we can link these issues, does this give us new planning tools to prepare for these type of events? So we think about PRB, the Population Reference Bureau, and our work in connecting these dots. But I'd like to also invite you to think about other dimensions of population health and environment. And I'd like to talk to you in this presentation about the promise that this integration offers. Tell you how we are using these promises to test it on the ground to get a sense of the reality of this integration in communities and in different countries, and to have a sense of what are some of the concrete benefits that we can talk about when we want to integrate population health and environment issues, when we seek to connect the dots. In terms of population and environment approaches, we are really working at how we can slice this issue. How can we get a sense of what is happening on the ground? And in our work, we pit population at the center of this effort. And by population, we look at the issues related to gender, age, location, education, and other socioeconomic characteristics, and look at how these population variables interact with the human-made environment, taking into account things like infrastructure, institutions, politics, culture, information, and technology, and see how that relates to the natural environment, looking at issues such as land, water, air. So if you look at the dotted lines here in this slide, we see that we attempt to take a slice of this picture, and perhaps here have a possible focus on just one aspect of what's happening, and looking at how these variables all interact and come together. So this gives you a sense of this promise and this approach. More than 50 projects have been documented having these types of approaches, particularly at the community level. And what the literature, the evidence has shown is that generally these projects offer a number of promises. The first promise is an opportunity to improve access to family planning and to increase the involvement of women in development efforts. So building on what we heard from Nancy and Laurie. Usually these projects offer hope of facilitating community participation in development activities and usually conservation activities. And from an organizational point of view, we say that these projects tend to be more sustainable and cost-effective than programs that have a single sector approach. So instead of just looking at water in isolation, if you take into account the population dimensions, you get more bang for the buck, or as we say in the Philippines, more power for the peso. So it offers some hope. So these are the promises that this approach offers. And what we are doing is looking at the reality, the R on the ground, and saying, okay, we have a sense of these promises. What does that mean for us? From a programmatic point of view, an example of a project that's being implemented on the ground may be peer educators reach out to young people mobilized on environmental issues and provide sexual and reproductive health information. On the policy side, family planning policies enable couples to avoid unwanted pregnancies, reducing fertility and rates of population growth, therefore reducing pressure on environmental resources. So we set about to test and gather some evidence on these types of approaches. And I'll share with you one example of a project that we have in the Philippines that looks at reproductive health and coastal management that we are conducting in collaboration with Save the Children USA. And the project is called the People and Environment Coexistence Development Project. It's in the West Visayas region in the central area of the Philippines. Fairly small area, covering 4 municipalities, 12 villages, a population of about 19,000. The objective of this program is to provide choices for couples of reproductive age to have children at the time that they want to, while improving their capacity to ensure a healthy and secure environment for their children. And the approach is to have a number of integrated project activities whereby there is an integration throughout the project cycle. If you look at the image on the right screen, the right side of the screen, this is a family planning session being carried out at the health clinic. And the session is called Family Planning in Action, whereby couples of reproductive health age and families sit down and gather information about reproductive health choices and family planning options that are open for them. This is done in a context whereby they're able to make associations and linkages between these family planning options and the choices that they make and the impact that that has on their well-being, particularly their natural resources in that coastal area. From this family planning and action session, the community moves to a process whereby they map out the population dimensions of their community. So you have on the lower left-hand side a mapping process that moves directly from this family planning session, whereby they look at settlement patterns and how it's related to the natural resources. And it's a very interesting process because it's very participatory, and you have a number of people in the community that are involved. From this, they move to the top left-hand side of the slide where they go into a mangrove reforestation process. So in this integrated project activity for the local community, family planning and reproductive health choices and information are clearly tied to a community mobilization tool that's very visual and active and alive, and is a way of gathering information for them to mangrove reforestation, which is very clearly documented, and this evidence is then used for the community for their own development planning and to communicate with local policymakers. In parallel with these activities, we also use integrated project indicators. And here you have an example of an indicator, the percentage of couples using a modern family planning method and citing the environment as one of the reasons. So you imagine that the husband has come home and he says, "Honey, tonight's the night." And she says, "No, darling, we got to think of the mangroves." So it's a new test for Nancy's virility indicator. So not exactly that way, but we're trying to see how these type of issues come up. We also have, as Laurie mentioned, it's very important to get communication messages out that convey how these issues are related. So the message that we use here is, with family planning, your health is ensured, your environment is saved. And that is a message that we have been able to document that has arrived to policymakers, that policymakers have been receptive to this message. Through the project, we have been able to work at gathering data and information through these family planning action sessions. And here you have a table that presents the data collected in all of the municipalities and the villages where we're working, that has been able to show that over a short period of time, the total contraceptive prevalence rate, which was prior to this linked intervention was at 38%, has gone up to 45%. So we've been able to gather this kind of evidence. We've also seen at the same time an increase in environmental protection, because we have been working in association with the University of the Philippines in the area to work with these local communities to help them develop tools to collect data, baseline data, and then current data in terms of where they are. And we have seen evidence that there's been an increase in mangrove reforestation and in marine protected areas. Once again, we are talking about a very small area, but we are gathering this information at the scale and would like to think about other ways to move forward with that. As we look at this type of project and this type of integrated approach, we talk about a number of assumptions in these projects. Family planning programs could be part of a strategy to reduce demographic pressures on protected areas, and reduced population growth would have a beneficial impact on the long-term sustainable use of natural resources. Some of the conditions for these assumptions to be true would be that locals perceive family planning as beneficial, that this is something that they want, it's voluntary, that in-migration will be balanced by out-migration, and that natural resource use does not increase over time or becomes more sustainable. So these are some of the assumptions and conditions under which we try to work or explore further to see whether they are true. What we've been finding in terms of the R, or the reality, what is working, is that research or evidence suggests that integration makes sense in particular contexts. And here we did a baseline investigation that showed that the community was receptive to this, that there were policy opportunities to move this forward, so it made sense in this community, that mechanisms exist for integration, that Save the Children was prepared to put in place an organizational structure that allowed them to do this, even though they did not have experience and expertise in coastal resource management, but they were prepared to develop or partner with organizations to develop this expertise, and that there were creative ways to link population and environment issues to policy priorities. When this approach was taken to local policymakers, it was not a population and environment issue. It was a poverty alleviation issue. And that's when the mayors got interested. That's when they wanted to know more about it. So it's similar to Laurie's last point on how to present this to policymakers. When we're able to do that, it works. What does not work, and we're learning more and more about the many things that don't work, is when the opportunity does not match community needs. When we think that there is an opportunity to do integration, but we soon discover that it's not what the community wants. And we've seen an example of this, of a few projects in Guatemala, whereby a conservation organization may have gone in and wanted to start with a conservation focus. And what the community really wanted, first of all, was public health services. So starting on a conservation note turned that community off. So having a clear sense of what the community needs are. When the intervention is not the correct one, for example, if there's a focus on family planning, and really the issue that needs to be addressed in that particular context may be migration into protected areas, or when you have a single sector approach, as we saw with the example of the tsunami disaster, whereby if we had focused more on sustainable tourism efforts as opposed to just focusing on economic development in those areas, we may have had a more sustainable base on which to deal with these issues. So we looked at the possible, the promise to look at the reality, to talk a little bit about the benefits. And we've seen some examples of conservation benefits, and we've seen some examples of reproductive health gains. We also saw that there were a number of livelihood opportunity examples and opportunities for communicating with policymakers. In the particular project in the Philippines, we discovered that what worked for the communities and why they were so receptive toward this was that it provided an opportunity to make their economic base more sustainable, and it promoted the use of the involvement of women in economic activities. So it made a lot of sense for them. And evidence-based decision-making and advocacy was important, particularly in the Philippine context where reproductive health issues are so volatile. It allowed us to address reproductive health issues indirectly through an environment lens. So it really worked quite well there. So when you think of PRB, I would also invite you to think about our work on population health and environment and ways that we can connect the dots, and think of the promises and realities and benefits of this integrated approach. So thank you.
Thank you, Roger Mark. And now we'll all come up front. And this is the period in which we invite your participation, your questions, your comments, your opinions, your brickbats. We'll take it all. In so doing, I hope it will encourage you and not discourage you to know that this session is being webcast live. But I do need to tell you that, so that those of you who were almost ready to hold up your hand will now do so, or will feel cautious about it in either case. So I'm going to sit down. I'm going to welcome your questions or your comments. Please be economical in terms of time, and I'll encourage my colleagues to do the same in response. And let's get a conversation going.
In your discussions of use of family planning, you didn't mention availability of family planning. How did that play a part?
You want me to go ahead? That's a very good question. And like so many of the issues I presented, the data are complicated. And it doesn't have a quick one-line answer. There are a lot of reasons why women and couples don't use family planning. Availability is not always the most important issue, although we do know that contraceptive supplies are not necessarily keeping up with needs in all countries. We have growing needs because of growing population growth, but the donor supply, the subsidized contraceptives, are relatively flat, so they may not be keeping up with needs. That is a problem. But when you look at why people don't use family planning, there are a whole range of concerns, and it's not just supplies. The gender issues that Nancy talked about, women sometimes don't use because they're not empowered to make the decision. They are dependent on husbands or other people's decisions. They may be concerned about side effects of methods. There may be cultural or religious opposition, or some women just simply don't have the knowledge to understand that they may be at risk of pregnancy and that there are methods that are appropriate for their situation. They may not know enough to practice family planning or choose an appropriate method. And all of these concerns, not just availability, have to be addressed by programs. So when you think about why do we still need programs, it's not just delivery of contraceptives. Programs are needed to address the social, behavioral, and other components of family planning use.
Jeff?
This is terrific to not have to be up front moderating, Bill. You'll have to come and do this more often. You can actually think about a question. I'd like to, I guess, applaud and amplify the point that came out, particularly in Lori and Roger Mark's presentations, about linking family planning and reproductive health issues to other sectors. So we heard about the Millennium Development Goals and the notion of a larger development discourse and a whole other set of actors and partners there that may or may not be plugged into these issues. And obviously, with Roger Mark and his work on population and environment, again, it's kind of a basic assumption. And I think PRB is a leader in doing this. And I guess it's really, in some respects, the raison d'etre for our project. But I find myself wondering why this isn't something that is done more often by more people. I wish there were more, say, population-focused organizations such as your own that were willing to take that on and try to find those kinds of partnerships and expand the dialogue, because I think in many respects, as Lori said, the challenge is to find partners and advocates who are not directly within the field. And so my question to you is, in some sense we've heard where you see some of the advantages. Why do you think not as many people see those advantages, pursue those advantages, and are there particular target audiences in addition to some of the development ones that and environment ones you've highlighted? I think the notion of repositioning family planning is a terrific one. I think in some cases it doesn't seem to go farther than just a discourse or a dialogue with folks in AIDS. And it seems to me there's a much broader set of actors that this repositioning discussion could go on with. So your comments on that would be most welcome.
I'm happy to answer that to the extent I can, and I'd also like to ask people who are here from USAID to also speak up about what they're doing with regard to repositioning. I've already forgotten. I do think that people are aware that family planning is a good investment and it has health benefits and sort of all those good things I outlined, but they may think it's already been done. This is a program that has a long history and it has been successful, and sometimes there are disadvantages to being successful. And this goes back to the the paper that I talked about, that Amy Choi and Anne Blank wrote, they called it, they talked about the dilemma of success, the demise of the family planning movement. The problem with being successful is that people think it's already done. And particularly when you see news reports that, hey, this problem's been solved, people think, well, we already have family planning programs, don't we? And aren't they already accomplishing what we set out to do? And people may be thinking of it as done and not necessarily something that needs a sustained, continuous commitment that you have to keep plugging away at so that there's not backsliding, and there's still many years of work to be done. So that's my view, is that you have to continue the arguments, because the battle is never won, even though people might perceive that your work is done. But I'd like to ask people from AID to talk about that. Who we're engaging with in trying to reposition family planning. Are there new partners that haven't been reached before? I mean, we at PRB try to reach a very broad range of audiences, including religious groups, community groups, people not working in health, and so forth. But AID is also aware of the need to reach diverse audiences, and if anybody would like to speak to that, please do.
Thanks, Lori. Thank you, all of you, for really wonderful presentations. I'm Ellen Starbird from the Office of Population and Reproductive Health at USAID, and let me just try and respond quickly to what Lori was mentioning. The office does have an initiative called Repositioning Family Planning. It's at present focused in Africa and in 2 or 3 particular countries where family planning really has not moved. In the early 80s, or throughout the 80s into the 90s, and even today, we have a very comprehensive policy program within the office aimed at engaging policymakers in family planning issues, getting their support for family planning, funding for family planning, and increasing the role of the private sector. I think in the 80s and 90s, a lot of the focus in that program was helping policymakers see why family planning was important to other things that they were concerned about in development, what the impact of rapid population growth was on housing or on jobs or on schools. And that was quite successful. And sort of as Lori said, that having been successful, we moved on to talk with them about more small p policy programmatic things like finding the money and building the capacity in country for civil society to advocate. And one of the things we're trying to do with this repositioning effort is go back a little bit to what are the issues that resonate with policymakers that is going to make family planning salient with them again. How do we link it to HIV/AIDS? How do we link it to the Millennium Development Goals that we care about? What are the ways to demonstrate that it really needs to be on their agenda because it helps them accomplish things that they care about? So that's part of the initiative. The other is to really understand what it is that makes programs work in some places and not in others. What are the components of successful programs, and how do we take that knowledge and information and share it and adapt it in countries where maybe family planning has stalled? So that's a little bit of what we're doing in this fairly new initiative.
Nancy?
Back to your original comment on why more people don't try to integrate these issues. I think part of it is that each one is technically very sophisticated. And so you feel like you've just mastered your understanding of demography. It takes years to understand the subtleties, and now you have to also master the economic side of the other sectors. And in the press of work, to do development work, you have to work hard enough just in the sector you're in. And sometimes people just competing for funds, trying to get done everything that they have to do, they don't master the vocabulary and the issues from the other sectors, so it's hard to have a dialogue. But we know from our work, where we try very hard to use vocabulary that crosses over sectors, that people want the information. The best example I can think of is a bulletin we did on HIV/AIDS. We have quite a few bankers actually on our list in Africa, and we got letters from the bankers asking for multiple copies because they needed that information formatted very clearly to show how HIV/AIDS was affecting their work. So it's the extra effort taken to understand a complex set of issues, and people don't take the time, they don't have the time. It doesn't mean it's not an extremely important challenge.
Tom Merrick, a former PRBer. First, congratulate PRB on its 75th anniversary and congratulate the speakers for their excellent presentations. I wanted to add to Lori's comments on the whole family planning HIV/AIDS history and make 2 points. The first is that at the early stages of the AIDS epidemic, family planning really didn't engage on HIV/AIDS. In fact, it resisted engagement. So that as the HIV/AIDS, you could call it a movement, gained momentum during the 1990s, family planning, along with a lot of the other health subsectors, was viewed as, not viewed as a partner, and in fact was often viewed as competition. And so when family planners would come to the HIV/AIDS community, I'm thinking of many of our World Bank projects, asking for support for contraceptives, you know, the hand would go up and say, no, 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 you're trying to divert effort from a problem that's already or still underfunded. Now, it seems, in our view, hardly underfunded, but in their view, we were competition. The second point is that in Africa, I don't think it's as prevalent today, with some exceptions. There is still a perception among leaders that the population problem no longer exists because of HIV/AIDS mortality. And Uganda, which you cited, is a case in point. The president of Uganda is a very strong HIV advocate in terms of prevention and ABCs and all that, but still thinks that family planning is bad for Uganda. And until that kind of thinking can be corrected, overcome, engaged in a constructive way, there's a real problem of leadership commitment in many African countries. So those were my 2 points, and I think particularly challenging points as family planning and reproductive health now tries to re-engage with the HIV/AIDS community.
Charlie?
Hi, I'm Charles Teller from USAID's Global Health. I see up there are 4 panelists, and I haven't heard from the 4th, who's Bill Butz. I think that Bill can help us to connect the dots. I think that Roger Mark's points are very well taken, that in order to connect the dots, we have to see what is the felt need out there, which dots should be connected. And it's not easy, because the macro and the micro dots are not easy to connect. But I'd like to know their perspective from a prominent economic demographer like Bill Butz, how he would connect the dots. I think that one of the problems from a sociological perspective is that each has its own dots. And the husband who comes home and says, honey, it's our night, he may have a perspective that is quite different from his wife. The mango grove may represent the prestige or the importance of the community and in attracting resources, whereas the wife may have a very different health or other perspective. But I'd like to ask if Bill could help us connect the macro dots with the micro dots.
Well, I think another reason perhaps for the confusion or current lack of passion and enthusiasm for family planning around the world has to do with these relationships between micro and macro. There's a history of at least 60 years standing of scholars trying to figure out what the effects are of population growth on economic and social development. It began in 1958 with a famous book by Cole and Hoover, and is extended to several National Academy studies in the early 70s, early 80s, late 80s, and then a book by Nancy Birdsall and Steve Sending and someone else whom I can't remember at the moment in 2001, all asking the question, what relationship is there between, on the one hand, the population size or population growth rate of a country or a region, and on the other hand, its development, how fast its per capita income grows, how fast its social and political development proceeds. In this history, there's about 20 years in between the early 70s and the early 90s in which the received wisdom that was published in these books was either that there isn't any relationship or that it's too complex to characterize. So because of these studies, I think just partly, these studies had the effect, while some of these other things were going on, and perhaps a little bit earlier, of depassionizing the commitment to family planning. Because after all, if we can't say whether countries that have faster rates of population growth do worse or better in respect to the way we're able to measure people's livelihood and people's standard of living, then there goes one of the major reasons for family planning. Now, more recently, the most recent compilation of this evidence, the 2001 book, returns us to a view that the balance of evidence, that is the balance of scientific studies on the subject, principally by economists, demographers, and statisticians, is that there is a relationship, that population growth is on balance in most cases, under most circumstances that exist in high fertility countries and medium fertility countries, inimical to harmful to economic development and to growth of per capita income. But I think this history of back and forth since Cole and Hoover through the National Academy studies and on to the 2001 volume have, in my view, somewhat blunted at least one argument, and I might say in particular an argument that tends to have an appeal in ministries of finance, the people with green eye shades who are trying to decide whether to invest in a dam or whether to invest in, let's say, family planning programs or a new airport. The bottom line, what's the bottom line? Well, if there's ambiguity about whether family planning programs, whether their effect of reducing population growth rates has an effect on people's livelihood, well, then maybe I'll decide with my green eye shade to invest in the airport or the dam or the new road system instead.
I think that 2001 book actually took a different tack because it looked at the positive case where population growth had gone down, yes, and showed that in countries, for instance in Korea, where there was a rapid decline in population growth, that the benefits of having a changed age structure and having more people in the productive years and fewer dependents contributed to economic growth. So they actually used a different methodology, not just sort of a broad kind of statistical comparison across countries. And that, I think, is why they were able to come up with some evidence to deconstruct that very complex scenario.
I think that's exactly right. Next.
Thank you. I'm Wouter Wiening with the Institute for Environmental Security in The Hague, Netherlands. We do mapping of ecological risk situations using remote sensing very much, and also in the Indian Ocean, seeing whether we can contribute to an early warning system for the tsunami impact. I would like to ask Roger Mark whether you are involved in a survey of linking ecological risk situation with population overcrowdedness and the things you were doing. And if you do, then maybe we could talk afterwards how we can link up a little bit. Thank you.
Thanks very much. I'd love to talk afterwards. The meeting that we had in Thailand was an attempt
to do more of this work. We were actually working with the City University of New York, a seasoned center out of Columbia University also that had been doing some of the mapping around the tsunami work, working with a center that had been set up with a university in Thailand and the International Institute of Applied Systems Analysis out of Austria, IASA, that has been doing modeling for population and environment integration and linkages. And what we are working on right now is exactly that, thinking about what are the elements that needs to go into models to look at risk and vulnerability with regard to disaster preparedness and rehabilitation. And this is something that we're looking at also even within the context of urban areas, particularly working in a country like the Philippines, where a number of urban populations have been susceptible to these disasters. So yes.
I want to go back to Bill Butz's remarks on Barbara Seligman in the Office of Population and Reproductive Health. And my question for you, Bill, is, you know, if the folks with the green eye shades viewpoints have been affected by the uncertainty or the inconclusiveness of the relationships between population factors and economic growth, then is population really any different than primary health care, for example? And what is it about sort of the situation of population versus primary health care in general that is any different today?
I don't know the answer to that question, Barbara, but I don't know what the differences are that matter when the people with the green eye shades are looking at the evidence. I will emphasize, though, that I think the people with the green eye shades are extremely important. We frequently, at the highest level of aggregation, we focus at the highest level at ministries of health, or maybe ministries of education, or if there's a ministry of manpower, that. But very frequently, I think, as we know in this country and in others, it's the Ministry of Finance or the Department of the Treasury or the OMB in our case that really makes the ultimate decisions of who gets the money. And the arguments can be very, very good, but at the end there's a bottom line. And I do think that the information, the evidence about that has been presented here today, and this kind of evidence can very usefully be formatted and packaged somewhat differently in terms of the kinds of dollar and cents, or at least quantitative. Maternal deaths, I think, deaths from maternal causes, is the kind of objective, easily understood number that can be tied back, on the one hand, to investments in family planning and reproductive health and rights, and on the other hand, forward to measurable consequences for the economy in terms of costs of loss of human life and the like. And I do think that we tend to underinvest in making that kind of translation. That didn't answer your question, but okay. And I'm sorry, I missed, yeah.
Hi, I'm Gary Saff. It's Johns Hopkins Center for Communication Programs. As I look at the questions that are revolving around family planning and its repositioning in its place, I'm thinking of the demand side for this. If we take a look at a country like Indonesia, where over a period of time you had a collapse in economy, a collapse in governance, and significant upheaval and change, you had a contraceptive prevalence rate that at the end of the day was able to sustain it because there's almost at a normative kind of expectation and behavior that people who are using contraceptives will continue to use contraceptives. If I look at low prevalence countries, 20%, 25%, compared to higher prevalence countries, 50%, 60%, and if I'm in the food business, the soft drink business, any business, to capture 20% of a share of a market would be enormously appealing and worth the investment. So my question is, as we look at the influence on policymakers, as we look at decision making, as we look at funding streams, are we capitalizing on the demand that already exists in these countries, among the people, among the couples, in the communities, for family planning and the role that that plays in influencing decision making. It's different than data. It really is a public face and a family and a demand-driven rather than data-driven kind of strategy. Can we do more is the question.
I'm hearing you say it's demand, not data, but data can shed a lot of light on the nature of the demand, so I can't really separate the two.
I didn't mean to do it as a or.
When you talk about demand being well established in a country, that's fine if you're talking about the country in the aggregate, but we can break the data down and look at it disaggregated, and the averages are, I think, misleading. Demand is very different among poor, uneducated, rural men and women, and those communities may be isolated from other communities where demand is well established. So the market's not uniform, and no, family planning doesn't draw in suppliers and investors. We know that even in this country, it's not a big attractive market. And there is an adequate supply at reasonable costs in this country. So we know that it's something that doesn't automatically work through economic forces alone. So we're very concerned about what the disaggregated data shows us and what groups are left behind and what groups have not caught on to this wave of everybody now accepts family planning. And it's the marginal, vulnerable groups. If we don't meet their needs, these are the groups that also have all the other health concerns. And in their lives, all those concerns are connected. And are they adequately being addressed? Probably not. We know that most health investments, most health dollars benefit the better off more than the worst off. Data also shows us this. And because we know that that's sort of a force that happens naturally in every country, it takes leadership, it takes priority attention to the inequities and to the neediest groups to redirect the resources and make sure that those who need it most are benefiting. And I do think that needs intervention. I don't think it happens on its own.
That very issue has been studied in quite a few countries around the world, and the one that comes to mind is Bangladesh, where people were surprised originally that the family planning program in Bangladesh was as successful as it was, but then it stalled out. And really the idea was that the latent demand that you were talking about was met by the family planning program. An excellent family planning program took services to people, but then the group that was left, the most disenfranchised, the people who lacked education and resources, they didn't have the demand for the services and they didn't know how to access them, so extra effort would be needed to reach those people. It's not a simple, straight line kind of thing. There is a lot of demand out there that probably isn't being effectively met, and there's a lot of people who don't have that level of demand because of the circumstances in which they live.
Martin, did you?
So Gary asked a similar issue I was going to raise, and I was basically going to say that maybe a lot of the discussion is too much at the macro level, a bit like Laurie was saying. While at the macro level we're making great strides, and lots of countries have reached prevalence of 70%, 75%, and they're there. Other ones have prevalence of 15%, and that disenfranchised subpopulation that Laurie just referred to. So I think, we need to be aware that this is not a macro issue. We have to go back to individual countries and deal with them. And some other countries are there. Maybe they do need less support. They need maintenance, but other people need real interventions. And I think it's important to bear that in mind for the reposition of family planning effort too.
Thanks. I'm Judy Oglethorpe from the World Wildlife Fund. And I think it's these very populations that we're most concerned in working about in integrated population health environment programs. These are communities that are in very remote areas that are sort of the least developed communities in a country, but are also the ones who are the stewards of the environment, of natural resources, often of watersheds that are providing important water supplies to cities and so on. And certainly, having just spent 2 weeks bumping around incredibly bad roads in Madagascar, we fully understand why it's so much more expensive to reach these communities with family planning services. There's much less bang for the buck reaching these communities than say, reaching people in cities, and it's fully understandable why they've got left behind. But yet, from an environment point of view, from a development point of view, and very often from a national point of view, economically, it's really important to reach these communities. We're very grateful. We have money from the Population Office of USAID for some projects, but we're able to use those funds for certain communities. We can't scale up to whole regions, landscapes with this. We have some learning funds, and we're actually looking at, well, how can we scale this up more? And we've been talking a lot to our health partners in this as well. And we are seeing some early signs of leverage. Some of our health partner in Kenya, for instance, having been invited into a remote area of Kenya on the northern Kenya coast through a WWF project, has now managed to leverage more funds to reach additional communities and is interested in scaling this up. So I think maybe we can sort of work together to try and catalyze this sort of scaling up and reaching these disadvantaged communities more. We're certainly interested in thinking more about this and talking to people about it. Thanks.
Two in a row there. Hazel.
Well, I was wondering if I might go back to the actual role of PRB to look at both U.S. and international population issues. And I noticed Laurie said, if America doesn't want it, why should you introduce it? And sort of the whole influence of the U.S. on what's happening overseas. What I'm looking at is the fact that nearly half of all pregnancies here in the U.S. are either unwanted or mistimed. And I'm wondering whether we should also be talking about repositioning family planning here at home as a way of thinking about overseas.
In fact, we might.
The answer is yes.
Yes. we might invite our panelists to turn their attention ever so briefly to the U.S. in terms of gender, in terms of fertility and family planning, and in terms of the environment. The U.S., after all, is one of only a very few countries in the world in which fertility rates are not falling, and we certainly have environmental issues and gender issues. Laurie, do you want to start with that particular question? And
That's really not fair, Bill. We're international programs. You have PRB's domestic programs sitting in the
Well, I know it's not fair, but life is not fair sometimes. Laurie, do you want to start?
No, I would say that much of what I was talking about with regard to family planning internationally is also true in the U.S. I don't have the data on the U.S. that I can pull out quite as handily as I can on developing countries. But yes, there are subpopulations in the U.S. that are severely underserved by family planning and other health services. And you could say we're at a crossroads in the U.S. too, because when you're under political attack all the time, you can't make progress. You spend all of your time dealing with political issues, but you're not necessarily moving forward on the programmatic and operational and other issues that you need to accomplish. So yes, the two movements, domestic and international, are probably working in parallel, and perhaps we don't work together enough. Thanks for the comment.
And also, if you look at low fertility countries, meaning replacement level or lower, the U.S. has the highest fertility among the low fertility countries compared to many countries in Europe. And interesting assessments about why that is. Partly it's the diversity of the U.S. population. We have many immigrant communities living here who bring fertility patterns from their home countries. Our whole immigration system and how people become citizens of the U.S. is dramatically different. And there are pockets of poverty and disenfranchised people in the U.S. that aren't getting services. So I think there's a lot we could learn and apply to U.S. policy from the work that goes on in these populations overseas.
And just sort of a brief word in terms of the environment component. Prior to working at PRB, I worked on an initiative that had been established by President Clinton, the President's Council on Sustainable Development. And this council worked towards making recommendations to the administration on how to put the United States on a path to sustainable development. And there were 8 task forces that were formed to look at various issues within the United States. The task force that was formed the last and was by far the most contentious was the one that focused on population, and it was called population and consumption. And there were two issues that stalled the work of that council. The first one was how you define economic growth and what economic growth meant. And the second was this population issue. And population, because it had the consumption dimensions and because population referred to abortion and immigration. And that also reminds us a lot of the discussions that had occurred within the Sierra Club about the impact of immigration on the environment. So it's a very difficult issue to work on in the United States, and certainly the consumption aspect of it is very, very important. In terms of PRB's work, how we have approached that, and Nancy has rightly said that we here on the panel focus more on international work, but we have partnered with the Sierra Club, the National Audubon Society, and the League of Women Voters to produce a number of education materials that are used both in the classroom and with local communities to help them have a better sense of how these issues come together. We're also currently producing a number of lesson plans that are being used at the AP geography classes that focus on population and environment. So we're working with educators and getting this information and understanding with the younger generation. So those are some of the things that we are doing right now.
And as Nancy said, the experts who are up here are not our chief experts in domestic U.S. policy. We have those as well, several of whom are here in the room and speaking in other forums. Reeve, did you want to?
Reeve Veneman at the University of Maryland. I want to get back to the question where we started about why it's difficult to build these integrative teams and integrative projects when we know that those are the things that work best. And Nancy's response and answer is that intellectually it's very difficult. We spend all our careers getting trained as demographers or as environmental scientists or something, and so it's hard to then, after doing all that, get the expertise you need in the other areas. Well, the answer, of course, to that is to build teams. You build teams of environmental scientists, public policy experts, various people, and those teams can attack these integrated projects. But why is it difficult then to build these teams? I mean, I go back to an era earlier when Bill and I worked at the National Science Foundation, and we watched physical scientists and life sciences build these teams just as a matter of course. They're very good at this. You think about human genome projects, computer scientists, physicists, all types of folks to get together and work together on a team. And as social scientists, we're way behind in this. We just do not do that. And I've puzzled for a long while about why social science is slow in building these kinds of integrated teams. And I have an answer, or a hypothesis at least, and that is that the people in this room, the demographers, the environmental scientists, public policy people, are probably very good at doing this interdisciplinary kind of work. Our intellectual climates, our training, our multi-paradigm, multi-methods. We're good at thinking about how other people think about these issues. However, these teams also need economists and physicians. Okay. And I would argue that that's the weak link here, that economics and medical scientists are not good in general at forming these interdisciplinary teams because they have one way of looking at things and one way of analyzing things, and until we can get them on board, we're going to have a hard time creating these integrative teams to tackle these integrative issues.
That's a very powerful hypothesis, and I had not thought of it exactly that way, but being an economist and knowing a lot of physicians, I think
I can give a concrete and somewhat humorous confirmation to that. I have been forced onto a team that includes a lot of economists and physicians, and we were sitting in a room discussing where we were going to go, and one of them said, who happens to be a physician, said, "Yeah, and when PRB finishes dumbing down the information," I was like, "Wait a minute, we're not dumbing down your information; we're making it accessible." And so we were just like we're in such a different place about how you can use language to communicate important information. And I called him on it, and he apologized. But I think in his heart of hearts, he still is worried that we're going to be dumbing down his sacred medical information.
I think we have time for one more. Charlie.
Actually, this comes from my colleague, Jeff Spieler, who had to leave. He's head of the research division in Office of Population. And this is intended for Lori. He's asking, in these countries with low fertility rates, particularly under replacement, how would the message of optimal birth spacing be received versus a more general family limitation or family size message?
I'm not sure how you talk about spacing when people have only one child. And I'm not sure that you can go back and tell Jeff that next time he wants to ask a question, he should be here. No, I'm not sure that birth spacing is the message that you need to get. It may be one. It could be one concern and one issue, but I think what's more important in the low fertility countries is how effectively women are able to meet their goals, whether it's to have children or not have children, and how can you make their planning more effective. They need to have the right methods available. And in the low fertility countries in Eastern Europe and the former Soviet countries, it's far too easy to get an abortion and far too difficult to access pills and modern contraceptive methods. They have not been widely available. The health providers have not been trained well to dispense them and counsel on them and so forth. And what you really want to get at is what's the healthiest way for women to achieve their desired family size. So it's a health message, and it's an educational message about use of appropriate contraceptive methods. To me, that's more important than the birth spacing message, but not to say there isn't any issue. I think Tom has a comment.
Okay.
I was going to make a comment on Tom's earlier comment, but I want to hear your next question.
Well, again, it's a comment on the multi-sectoral question, and it's one that we've struggled with. Again, I'm speaking from World Bank experience of why it's so difficult to get teams together that would work across sectors. And part of the problem, at least in the bank and in our colleague countries, is that we're organized into sectoral silos. And the reward system rewards you for having a health project or a water project or a roads project or an education project. And so you get promoted and you get recognition by being in charge in your sector. And when you try to design something that reaches across sectors, the other people won't play because they're not going to get rewarded. And then the one group that's exempted from this kind of thing, as was suggested, is the economists who are working at the Ministry of Finance level and controlling the purse strings. And they have this narrow vision of everything in terms of economics, cost-benefit analysis, how to allocate scarce resources. So it's a really difficult task to get people to work across sectors. But I think the secret of it is in the incentives. When people are rewarded for working across sectors rather than being a task team leader or a project leader within their sector.
I think you're absolutely right about that. And surely if anyone would respond to incentives, it must be economists. Maybe we ought to try it. Well, we've come near the end, and I want to take about 2 minutes to wrap up. I think we have decided that the world is complicated. It's complicated in the way our own behaviors and the behaviors of the families and households and communities we live in are related to each other. I think that's been evident in the evidence that's been presented and the arguments that have been made here and among you. And I think we've determined that in research and in policy and programs, these complications are not sufficiently reflected. Not sufficiently reflected to such an extent that it damages and prevents the kind of information, policy-relevant input information that would be useful to policymakers and decision makers. There is one area, though, I think, that we haven't said it explicitly, but where the dots are increasingly connected, and in fact, I would say quite well connected, and where the complexities of the world have become, in the last 15 years or so, adequately, not perfectly reflected, and that's in the data. There have been enormous improvements, and for that I would credit particularly the demographic and health surveys, and particularly USAID, for its intelligent efforts to invest in data that get outside the stovepipes. So I think we can no longer, although there should continue to be, and there are improvements, we can no longer place the blame on the data. I think the blame should be placed instead, if there's blame to be placed, or let's say the challenges, where we've put them. I think we've decided that disaggregated data and disaggregated looks at the world are important, that even in the low fertility countries there are high fertility subpopulations, and in countries where fertility is declining rapidly there are areas and people, and they tend to be poor, where fertility is not declining rapidly, and the same goes for the environment, for gender relationships, and the relationships among all of these things. I think we have determined, I hope we have, I think it's true, that there are approaches and policies that work. One of them is family planning. It's worked. For 50 years we've had it, and it has worked, and it is still working. It is palpably and demonstrably effective, and should be and must continue to receive investment, because these fertility rates that are falling are not going to continue falling by themselves. I think history suggests that. So there are approaches that work, including that historic approach about which we continue to learn more every month through research, demonstrations, and the like. But there are also new approaches that work, that are worthy, as Judy mentioned, of scaling up. And so we're not in a situation anymore where we don't know what to do. There are many cases in many circumstances around the world, whether we're talking about gender or population or reproductive health or rights, fertility, the environment. There are many approaches that demonstrably work, and we know the circumstances in which they work, and they are ready to one extent, to a greater or lesser extent, for scaling up. And what should have been next to last in my summary, but I'll put last, is that there have been substantial successes in outputs and outcomes. Nancy had some of them on one of her slides. Women's schooling has increased. Fertility rates are down in many places. Birth intervals are longer. So that there are successes. We needn't be down in the mouth about the efforts that we and our predecessors have made in the past. They've been effective. We now know even more things that are effective, and it's time to put this evidence to work in policies and programs. So that would be my summary. I want to conclude, though, particularly by thanking USAID for its support of Jeff's program and the Wilson Center, for its support of PRB, and of a number of the others that are in here. Without that, over the last 50 years, we would not have had the family planning efforts around the world. I believe we would not have had the fertility declines that we've seen, and we would not have the hope for the future that we have now. So life is difficult, but we appreciate that. And I also want to say, if you didn't notice it coming in, that there are lots of publications outside. They're free, so take 2 or 3. Give them to your friends. And when you get back to work or to home, turn on your computer and check out the PRB website. On it, you will find most of the publications, scholarly articles, and the like that have been referred to today. All you have to do is click on them, and they're there. And you'll find a variety of, in fact, of wealth, a cornucopia, a fire hydrant full of information that's useful. So we thank you, Jeff. I thank you again, and the Wilson Center. I thank my my expert colleagues and our other expert colleagues who stand behind what they've done. And I thank all of you for your patience, your participation, your enthusiasm, and on into the future, your passion. Thank you. What, guys? I think you got a roadshow.
No, that was good.
Just about everyone in
We got a roadshow.
high
Yeah.
percentage of people had comments, which is really, really
Yeah.
good.
We had about 55 people.
And about 25 of them made comments. Really good.
Hi, good to see you again. Yeah. You know, I since I've been traveling,
I was, no, he wasn't joking. I was supposed to be thinking about you and sort of explaining what was happening to the planet, so I hope I accomplished it.
Oh my God.
I've been sitting in these sessions and never come across you.
Bill Butz, it's a pleasure.
I don't know whether you guys have lunch, but we have a dining room right here on the second floor. Grab some food. If you guys plan to run back.
It sounds good. I don't know what everybody has.
Okay.
Come on, see us one of these days. Absolutely. You're very welcome to. That's our job. Also our pleasure.
Other resources you might have that might relate, and then from the analysis, look at what can you do to
very good. I would
address
suggest you get in touch with Roger Mark. Be a friend. Let me write this to you.
get system services like restoration.
Is it all? Is it his whole last name?
Our decision, all run together.
As well, by first watershed medicine and then have an educational thing as well. So we met, we look, and also do, structured advocacy.
Promoting development organizations to take funding to address the problems.
Yes, yeah.
Okay, wonderful. Well, I'm particularly interested.
Are you interested mainly in the U.S. or does it matter?
National, but my fiance is from India, so India possibly in 20 years I might move there and work first of all.
Roger Martin is a writer. Why don't you go up and introduce yourself?
I don't have my card with me, but I'll send you an email.
Yeah.
So,
let me. Let's say 6:30, which is the middle school. I think it'll be fun, and I'll send out a broadside to telling who all's going to. The other than Gary, Mark and his wife. He's the physical anthropology program director at PRB. And she's a high-level molecular biologist.
So
he's all up on the Neanderthal. He's also molecular anthropologist. So I think it'll be fun. So the three of us will be in charge of diverting the three of you with input. Your Gary is extremely interesting. He's a young man. 40 I know, yeah. Very broadly interesting person. Sort of run like that in the company. An excellent program. Wants us to do more innovative IT sorts of things. And of course, he told us about his international security, everything.
That sounds fascinating.
So he's very interested. Could be that you're coming. Yeah. Well, I'm going to get down from here.
We can experiment now with who do you pay, how do you monitor What are the indicators? If there's a conflict, how do we settle the dispute? How do we resolve it?
Right now, are you in Washington? No. Why? Are you part?
I'm just here until next Tuesday.
Well, we are here in Washington, but I'd love for us to keep in touch, let you know a little bit more about what we are doing, and see what the opportunities are. And that would be great because I will be interested Okay,
One of the connections I see, is that when you put in deforestation and mining in the industry, the harvest, it goes on off through the rivers, it goes on over, it will affect coral reefs around opportunities for tourism or for sea defense, and then it's going to change when it is sea level rise. So we very much social links, ecological links between the inner shield partners and the impact on This for us, we are not, we are user science, but we are not, working on developing a role model, so we steal, we live off others' work, but then what we probably are good at is to continue monitoring with radar-based radar we can develop the very small situations, and then the transformation to real finance.
I know there's a paper by you very much.
Yeah.
Very good. I'm glad to meet you. I'm glad that you came.
Yeah.
And then what I can do is finish this project on the mountain.
The sites where you work, the place where you work. What we, ideally, what we would like to do is to have in the Hague a quarterly. I don't know.
Did you see Jen? I'm not sure. Is she okay? Jen Howard. Is she in the stands? Okay, we'll catch us. All right, thanks. Thanks for coming.
I'm basically helping Jane out.
Is that all on the website?
Yes.
Okay, great. Perfect. Thank you so much.
Well, pleasure.
Nice to meet you.
Very
I
good
look forward to being in touch.
Not little I know. I know I don't know how little I know.
that kind of stuff will not lead that effort. We are interested in being involved, just because we don't have a formal presence. We have to do that in college. There's a recent initiative, and I'm sure it's at USAID, as part of the history of one of the chairs has really proposed that's involved a lot of civil engineers and construction. I met with them and they have not thought about the population dimension or the communication aspect of it. So we're sort of beginning those discussions. I hope that we can get involved. But that's, I would like to see that. Yeah. Yes. And so there was a document, some of it.
Just making decisions based on decisions, and everybody's moving cases from, we have to think about it, like we did it yesterday. You know what I mean? And so the dynamics of it are extraordinary. There will be no connecting where you know what I mean? You have had to do
Thanks for coming. Roger Mark, we'll be so that's my interest. A lot of the areas where I'm working are islands, the vulnerable population. So sort of looking
somewhat self-contained also.
Exactly.
So, sure.
So you're sort of pulling out from that experience and what are the lessons? Yeah, but do you have a call? I don't have my call with me, but I'd love to be in touch.
We've got a group called SEERS, which is training for disaster relief people.
Okay.
They are, they're very problematic and they are very academic in the sense
right.
They really just going to grab so much.
I mean to that.
So they basically, and when they knew of our, they were out very early in our project, they really wanted to do this.
Yeah. Right. Right. Yeah.
So they can learn,
yeah.
experiential learning, so they want to really research and see where is it working, where is it not working, what is this waiting, and then how do you build that into training programs so that the lessons learned from this can be incorporated into the series